Hello everyone. There are some frequently asked questions about penis enlargement surgeries and I wanted to answer them all in this video. I'm going to look at and read from my notebook from time to time. I have my notes because I don't want to miss anything. Now here is a question we came across once or twice. We perform the surgery and send the patient home and he opens the dressing the very same day. Unfortunately, we had two cases like that. They had infection and came back, even had abscess, and we had to take care of that. Now patients open the dressing out of the curiosity to see how it is looking. They cannot wait for 3 days. Normally, we discharge patient with dressing and say remove the dressing in the shower after 3 days. Shower does not harm anything and stitches should be knitted a little bit. But patient opens the dressing at the very same day out of the curiosity. If you open it early like that, it cannot be okay and it can get infected. You can catch the infection because the genital area is accepted as the dirtiest part of the body already. So if you open it before stitches properly can knit, it will most likely get infected. That's why you need to be patient. Take your antibiotics and do not open the dressing before the 3rd day. By saying 3rd day, you should not include the day of the surgery. You need to start counting from the next day. A little patience, please. Sometimes when a patient is very insistent, I send him a picture. We take before and after pictures of surgery. Apart from that, there is a question frequently asked during summer. When will I go into the pool or sea? 15 days later, unfortunately, because the water from the shower is fine, clean, sterile, but pool and sea water cannot be accepted as clean water. They are accepted as dirty water. If you go into pool or sea early, you will most likely get infected. That's why some of the patients come to Turkey, spend their holiday and undergo the operation just before they leave the country. Take this into consideration. Especially if you're coming from abroad. Another question is that why don't we take measurement on penis? I don't take measurement because you cannot logically measure the penis size. First of all, tissue there has many characters that prevent to take measurement, like it's made to not to measure it. First of all, it is a soft tissue. There are no bones in it, and there are no stable length in it. A part of that, this tissue can get erection, so it can get erection and go larger, and it cannot get soft and go smaller. If it is a retracted penis, it can shrink up to 1 centimeter. He may be upset or it may cold, so it can shrink, but it can be 18 centimeters during erection. How can you measure something like that? You don't see it on erection during surgery, and thanks to patients, they do not measure it on erection. So it is very difficult to measure this. It says like this on classical boots. Pull it and let it go and then take a picture. Is this objective? I don't think this is okay. I can pull penis in such a way that it can show 2-3 centimeter difference between two pictures. Normally, I don't share surgery or patient pictures, but on this video I will. This is a clear evidence on penis elongation. I think it clearly shows that there is 2 centimeters elongation. You can see it 100%. We made the elongation, but not thickening on this one yet. In this picture, there is a dent at the bottom of this penis because we removed the penis from the bone. When penis is removed from the bone, there occurs a dent. Now that part is approximately 2 centimeters. We elongate the skin on penis for it to be accommodated to this. We perform Y-plasty there. Elongation there is approximately as long as the handle of Y. You can see it on this picture. I will upload it here. I hope that I did. Dent at the bottom of the penis is as long as handle of Y. Dent at the bottom of the penis is approximately 2 centimeters. Y-shaped elongation on skin that we did at the bottom of the penis is approximately 2 centimeters also. This is real elongation because we remove the penis from the bone. We also elongate the skin on it. There is no need to measure it with a ruler at all. You can see how it is removed from the bone. Now, this picture is also the proof for why we do not only do elongation. We don't do only elongation because the elongation will be around 2 centimeter, not 6 centimeter like some of the fantastic maids claim. It is 2 centimeter and there is a dent at the bottom of the penis. 2 centimeter elongation alone will not satisfy anybody. That's why I don't do elongation only. There are some people that claim they only do elongation. I wish them the best. Patients will not be satisfied 100% for sure. That's why you need to do it with the thickening. And you need to inject fat to that dent at the bottom of the penis to fill it. That's why elongation needs to be done together with thickening. We do not take measures with centimeter because it's not logical. But you can see the elongation by looking at that dent. The elongation on skin is also as long as that. This is the clear evidence for elongation. I think when will the patient realize this? Even he measures it with a ruler. Only 6 months later the surgery, I think. Because that Y-shaped stitch at the bottom of the penis gets hard, tissues needs to heal, that fibrosis needs to get soft. It takes 3 to 6 months. Do not measure it with the ruler just after surgery. You cannot see it. You can only see it after tissues get softened. That's why I think it's illogical to measure it with a ruler after a short amount of time. I don't do measures. Another question that is frequently asked by patients is that what should I do for fat to last long? It depends on 2 things, 2 criteria. First, the quality of the fat. If the fat is high in quality, it can last for years. If it is not, most of it will dissolve in a year. I made another video about this. I will probably upload it before or after this one. What is the quality of fat? I am going to give example there. That's one. Quality of the fat. Secondly, movement on the fat tissue. Fat tissue cannot last in places that high in movement. For example, it cannot last in lips for women. They want it to last. They do not want to redo it frequently. They want it for us to inject their own fat to their lips. Fat tissue does not last in lips. Why? Because it is an area that high in movement. Even if she doesn't speak, she eventually need to eat. Movement affects fat tissue. I will last longer in places low in movement. Forehead, for example. I saw some patients 6 years after forehead injection. He fell down on his forehead as a child and sinus on his forehead collapsed. There is a dent there. He came to us and we did the fat injection and I saw this patient after 6 years. There is zero dissolving. Fat stayed just like the same. It lasts perfectly. Corner of the jaw, another great place for fat injection. I specifically follow some of the patients who I performed this surgery on Facebook. When they upload picture, I can see the jaw shape and the fat I injected. There are some patients I have followed for 8-10 years. Then they got married one after another and closed their Facebook pages. So I couldn't follow. Once who get married, immediately close their Facebook page. Fat lasts longer on the places that move less. That's why there needs to lower the movement on penis for 3 weeks, especially for 3 weeks, because in that 3 weeks fat tissue will turn into fibrous tissue and lost its fat characteristics. If there is a moment during that 3 weeks, fat tissue will dissolve into blood. There will be lots of loss. Some even admitted it. A patient came after 6 months and said that he faced lots of dissolving, but it is his fault because even though I told him otherwise, he Still had intercourse just after 10 days. You need to wait for 3 weeks to have intercourse. What else? You shouldn't have intercourse for 3 weeks. You shouldn't masturbate. Unfortunately, I know it's hard. Massage. Some clinics advise massage on penis. I can't even believe it. If you massage penis in the early period, fat will dissolve very easily. They claim that massages for fixing irregularities. That is what doctors has to do during the surgery. Fat needs to get spread properly. If it is not, there will be irregularities. If you advise massage to the patient, it will cause fat tissue dissolve into blood. Don't massage. What else? One of my patients asked, does blowjob count? Unfortunately, yes. There needs to be no movement on penis. Apart from that, these are what you can do to prevent fat dissolving. You are unlucky if the fat is low in quality. I recommend you to get a second fat injection. If the fat is low in quality, there will certainly be a lot of dissolving. I recommend another fat injection after 6 months or 1 year. It lasts longer on the second application. Since you injected into fat that turned into fibrous, it will less likely dissolve into blood. I performed this surgery since 2004, so my experience means something. I don't know. Pre-ejaculation is another thing that gets asked very frequently. Some patients said, I want to get penis enlargement surgery, and I also have pre-ejaculation problems. In our country, they do a filling at the top of the penis for pre-ejaculation. There are some articles published abroad on this topic, but I think this is nonsense. It is like giving antifebrile to a feverish patient. So what? What if there is an infection in his blood or body? If you don't treat infection properly, you can only lower his body temperature, and when the effect of the medicine is gone, it will go up again. You need to treat the disease itself. The treatment for pre-ejaculation is not filling at the top of the penis, as clear as day. That's a money trap. Don't spend your money on this nonsense. Treatment for pre-ejaculation is in the psychiatry. Simple as that. It is the subject matter of the psychiatry. The treatment of the pre-ejaculation is to training one's own body mentality. The one trains himself in such a way that this erection survives an hour long and ejaculate whenever he wants. This is possible, and the treatment of this can be achieved by psychiatrists. There are some psychiatrists who specialize especially in the subject. Go and see them. If I were to be a psychiatrist, I would go and complain about it to the Chamber of Medicine. Please do not waste your money for this. Filling the head of the penis will not be a remedy. It will dissolve in a couple of weeks. See psychiatry for pre-ejaculation. A frequently asked question too, apart from the others, is that why we elongate from the back of the penis and do not make the hole from the under of it. There is no need to stretch the skin from the bottom because its skin is very loose and adapts anyway. The part that does not adapt and cannot adapt to elongation and the penis is the back. We need to extend that part at the bottom of the penis, that is the back. We make it either Y-plasty or Z-plasty. Of course, it's not easy to understand them. In our specialization, you watch it for at least 1 or 2 years. You understand how it is. It's logical, and only then you allow you to make it. It's hard to tell right away, but let me explain. Z-plasty is as easy as this to understand. Look at my fingers, the distance from here to there, let's say 10 centimeters. Consider this as the skin of the bottom of the penis. We want to extend this like this. If you draw opposite zigzags and insert the zigzags into each other, the distance doubles. It became 10 centimeters. While it was 10 centimeters, but how? Look at the movement of my hands. As the triangle intertwined, the right side of the approach to the left side. In other words, here, the Z-plasty made is to transfer the elasticity of the skin from width to length. You don't add anything in between. The skin approaches from the sides and extends towards the length. This helps us lengthen the skin on the back of the penis. But there is no need to do it under the penis because the skin there is already very loose. In the meantime, let me attach an annotation. There are discourses such as, look, we are making an extension from the underside of the penis, not the back, etc. There cannot be an elongation making to the penis tissue from the underside of the penis. You cannot get the penis itself out from there. This is possible only from the back. Check out my technique on my website, peniscerrahisi.com. You can take the penis out only by cutting the suspensory ligament from the back of the penis. Those who say I do penis elongation from the underside, firstly, if there's a penissecretal web, it will have been treated and fixed. The penis seems to be elongated and it becomes easier to have intercourse because there is a skin leaf under the penis on the scrotal web. Once this is fixed, the penis enters the vagina more comfortably, etc. But it is not elongated for even 1 centimeter. I call them imitation, fake methods. You can elongate the penis only if you enter from the back and cut the suspensory ligaments. No other way. These words are for friends who say that we are elongating the penis without cutting the suspensory ligament and also upload pictures and put a cross on them in their videos. This is called a lie. If not, they should answer me. There is no such thing in the book Z-plasty or the fixing mate, etc. This is all about that I would like to say about it. If you got any questions, I can answer your questions. There are no other topics I noted. Thank you for watching, and I will invite you to watch my other videos on the website as well.